the distractor. The distractor, you need to pay close attention to this one, because then this one will help you. Hey there, everyone. Welcome back to another episode of the Brain PT. My name is Lily. I'm a neuro PT. And today's episode will be all about the anatomy of a test question. So, for people who are preparing, again, this is a NCS series. This is video number 7 out of 8. I think I'm planning more than 8, but the original series was supposed to be eight videos. So today's episode will be to introduce to you the anatomy of a test question. And this is just in general, any standardized test question, like the test questions done for NCS, the questions for NPTE, the questions for USMLE, all of those hard exam questions. So let's take a look and let's get started. All right, everyone. So let's talk about the anatomy of a test question. And we're going to go through some questions. That way you can practice and also see how I would approach a question like this. Okay. So it's important for you to know that every test question is composed by a clinical vignette. Okay. So most questions are going to be presented as this. So this clinical vignette will include the patient's demographics, the age, the gender, the occupation, when relevant, key symptoms and findings, like the presenting complaints or the physical findings. There might be sometimes lab data or imaging findings, whatever, right? Or like which setting are they in, etc. So this is this is called the stem. The stem of a question is the main scenario of the question. Okay. So then what's next is called the lead in, which is the actual question. This is the lead in. Okay. When you have a lead in or the actual question, this is specifically what they're asking you. Okay. It can be like choose or identify or which of the following or determine, or we'll see the lead in this particular question. So in this question, we have a 67-year-old patient who underwent removal of a pituitary tumor 2 months ago and is referred to outpatient physical therapy by their primary care physician. So when we're reading this, we're already thinking about, pituitary tumor, now we are deep in the brain, maybe areas of optic tract, right? We're formulating the hypotheses. Now, when you have a question, I suggest you highlight. Okay, you'll highlight, and you'll have that ability in the exam. You highlight specific things from the question. Okay, so in this case, in full mode, full screen, I cannot highlight, but here in this particular case, I would highlight removal of a pituitary tumor. Okay, and the patient reports continued difficulty completing activities of daily living. Okay, so activities of daily living is another thing that you need to pay attention to. Okay, so some people say that before you answer a question, you try to answer the question before you look at the answers. Okay, because some time ago, a long time ago, I think this was when I was in PT school, someone told me that our brain will start formulating the right answer. And then, we're presented with all these things, and then we start kind of like, oh, well, never mind, etc. So, okay, the lead in is on evaluation. The physical therapist is most likely to find, okay, so what are the findings as a therapist? So before you see the answers, you can already start thinking, okay, someone with a pituitary tumor, okay, removal, might show these particular things. Okay, so then the last part of a question are the answer choices. Okay, so we have one correct answer, which is the best response. Why? Because a lot of the other responses might be correct, but the best response is the correct answer. Now, then the other things that make up the answer choices are, and pay close attention, the distractors. Okay, in the set of answer choices, there will be a distractor. This is one very attractive answer that you start thinking, I think this is the right answer, right? It's the one that's kind of like distracting you from the right answer. Okay, so answers that might contain a partial truth, okay, or they are missing a crucial element, or it might be plausible but incorrect alternatives. So it's like a trap. Literally, it's a trap. So, and you'll see with the next question. So with this question, we have A, impairments in vision, B, involuntary movements, C, motor planning deficits, and D, neglect syndrome. Now, if you look at B, C, and D, well, let's take a step back. When you're answering a question, I need you to start crossing out the answers that really these are not the right answer. I need you to cross them. Like even when you're practicing, like if you have a Shepherd book or whatever, if you print these questions, these you can print from the ABPTS candidate guide, which is available online for you. There's a total of like 10 or more questions. Print them and cross the ones that you think and you are sure that they're not the right answer, even if it's one, because once you eliminate one answer choice, then your probability of getting the question right is going to increase. Okay, so just think about this. Okay, so I can eliminate neglect syndrome, because neglect syndrome, it's mainly seen if you came to my neuroanatomy workshop, we discussed neglect syndrome, and this is mainly in right parietal lobe involvement. So I really don't expect this patient have a neglect syndrome. Okay, motor planning deficits. Now, motor planning has to do with the supplementary motor areas. Again, if you came to my neuroanatomy workshop, you will be very familiar with these type of things because we discuss exactly those motor areas. And if you're interested in the neuroanatomy workshop, take a look at my website, thebrainpt.com. Under courses, you will see more information about the Neuroanatomy Simplified workshop. So I'm crossing D and C. Now, B, involuntary movements, that will really be more basal ganglia, right? Again, taking back to that neuroanatomy. So really, I expect the primary thing that my brain was already formulating was vision, right? Sitting right at the optic tract. So A is the right answer. Okay, so cross the distractors. Now, let me talk to you more about distractors. Distractors can also be options that would be right at a different stage in the disease process. Different stage. Also, distractors can be the trap. Remember, trap. Don't get caught in the trap. Pay special attention to qualifiers in the question that contain the word always, never, all of those like extreme. That is most likely a wrong answer. Okay? Also, pay special attention to qualifiers in the question stem that make these close but wrong. Okay? And also answers that share key terms with the question but don't actually answer the question. Okay? So some people recommend when you're reading the like a question, the stem and then the lead-in, right? To read from the end to the front. Like the end is what are they asking me? So in this case, we would read first, on evaluation, the physical therapist is most likely to find. So I am reading the lead in and then going back to the main stem. Okay, I'm thinking, what am I supposed to find with this case? And then without looking at the answers, I'm formulating a hypothesis. Now, these are techniques that people recommend, like for the USMLE, which is the medical school exam. So you try it, but I think it's a great idea to try that. Now, let me keep talking to you about incorrect choices. Distractors will also, remember, these are the choices that are attractive, that they are meant to distract you from the main correct answer. But also this might be may contain correct elements, but missing crucial components. Okay. Now also it can be oversimplifying, which is addressing only one aspect of a multifactorial problem. Okay, so that's the distractor. Pay attention to the distractors, okay, and eliminate the distractors, okay, the choices that you know that they are not correct. Moving on. Now, this question is related to the first case. Now, this one, when I answered it, I got really distracted. Okay. Which of the following functional activities? That is the key word or words. Functional activities. Is this patient most likely to have the greatest difficulty? Functional activities. Okay. Balancing a checkbook. Now we're thinking vision, right? Balancing a checkbook. Performing sit-to-stand transfers. Preparing a sandwich in the kitchen. Telephoning a family friend or family member. So functional activities, we're talking activity limitations, okay? Not participation restrictions. So here, when I saw this, I could easily cross B. Why? Because with vision, you really sit to stand, really, if you have impaired vision, I don't think your sit to stand transfers will be the biggest difficulty. So I crossed sit to stand transfers from the beginning. Okay. Now I'm left with balancing a checkbook, preparing a sandwich, and telephoning a family friend. I think telephoning a friend could be an attractive choice, but I don't think it's a functional activity. Okay. So I'm going to cross D. Now we're left with sandwich and balancing a checkbook. Now balancing a checkbook is really attractive, right? You need your vision to, see the numbers and, counting and, balancing. But I don't think this is a functional activity. Okay. So at first, when I saw this question, I got this wrong. I put balancing a checkbook. The right answer is preparing a sandwich. Why? Because that's eating. It's an ADL. So don't get into the trap. Functional activities. Okay. Read the keywords and highlight. Okay. The last one is, I hope this is making sense. Remember, start by eliminating obviously wrong answers. Look for extreme words, although the last question did not have an extreme word. Compare answers against each other to find commonality or a difference. And then when down to 2 to 3 choices, compare each directly to the question. Again, on the last one, functional activities. Okay. Again, these questions are going to be in the ABPTS Candidate Guide 2025. Okay. 54-year-old patient with multiple sclerosis reports persistent headaches. Okay, I am highlighting headaches. increased spasticity, highlighting, and itching over the lower extremities on the day of their outpatient physical therapy appointment. So here I'm thinking either infection, either a secondary, like a reaction to something, right? Something that's triggering, itching, increased tone or spasticity, headaches, something is going on, right? So I'm already formulating. They use a baclofen pump and ambulate with a standard cane and bilateral ankle-foot orthosis for distances within their neighborhood. They work full-time and adhere to their home stretching program. Good. On examination, the skin is intact. There is moderate scissoring during gait that is exaggerated from their baseline status. Which of the following is the most appropriate next step in management? Okay, so key things I'm highlighting: persistent headaches, increased spasticity, itching. They use baclofen pump. Could perhaps the baclofen pump be causing this issue? Okay, so I'm thinking baclofen pump and all the secondary. Could there be a connection? Okay, let's look at the answer choices and see if we can cross. Consultation with an orthotist for AFO assessment and probable brace revision. Okay, I can easily cross this one. I don't think the problem is the AFO. Initiation of physical therapy services bi-weekly for tone management. I don't think this question is really asking me about the plan of care. I think the tone, the highlight of the question is this person is going through something: headaches, increased tone, itching, what is it called? Side effect of something. Referral to a neurologist for possible baclofen pump dysfunction. Okay, this can be an option. Referral to a urologist for probable, oh God, did I say that right? Urinary tract infection. Okay, so we have two answer choices that could be. If you know, and if you don't know, stay tuned, because I have specifically this topic in one of my future courses on CVA, SCI, and TBI. There's something that is called a baclofen toxicity. It is very dangerous. And it causes some of these things that the question is asking. So I'm thinking there is a baclofen pump dysfunction happening. Okay, because a urinary tract infection will probably cause fever, chills, all of those other things. Something in the question would have told us something about infectious disease. So the answer choice here is C. Referral to neurologist for possible baclofen pump dysfunction. So I really hope this, sorry, I got it thinking on the question. I really hope this was helpful for you to start thinking about question answering. Again, you can find these things, these questions, in the ABPTS Candidate Guide 2025. And please check out all the resources I have, thebrainpt.com/resources, or my courses, thebrainpt.com/courses, and you'll find what I offer. So thanks so much for hanging out with me, and I hope I'll see you next time for another episode. Bye for now.